Good evening, guys. Today we will discussing about the terminologies in community health nursing. The previous video we will discuss about the terminologies in mental health nursing. Then another video here we will discussing the terminologies in community health nursing. If you have not subscribed my channel, please subscribe and share it is very helpful for nursing students. That first terminology is endemic. Endemic means the constant presence of disease within a geographical area. Endemic means it is the constant presence of disease within a geographical area. It is a presence of disease within a geographical area is known as endemic. It's containing hyperendemic, mesoendemic, holoendemic. It especially in mainly seen in children's. Holoendemic. Hyperendemic means it is more than in excess manner. It will be presents disease in a geographical manner is known as hyperendemic. Mesoendemic means it is in a middle or it is in lower than that hyperemic is known as mesoendemic. Holo means it is same as than hyperendemic. It is attaining large population in a geographical area. Holoendemic, especially in children. This about the endemic. Then epidemic means an outbreak of disease in a community in excess of normal expectation. Epidemic means an outbreak of disease in a community in excess of normal expectation. Example is COVID-19. It is an outbreak of disease in a community in excess of normal expectation. Is known as epidemic. Pandemic means an epidemic which is spread from country to country or over the whole world. Example COVID influenza. Pandemic means it is an endemic epidemic and which is spread from country to country or over the whole world. Example COVID or influenza. Then sporadic means the incidence at intervals, single scattered cases of disease. It is a incidence interval single scattered cases of disease is known as sporadic. Example rabies. Exotic means a disease is imported into a country. Exotic, it is a disease that is imported into a country, is known as exotic. Epidemic disease means an outbreak of disease in a bird population is known as epidemic disease. Then zoonotic disease means infections that are spread between people and animals. Zoonotic means infection that are spread between people and animals. Epizootic disease means epidemic outbreak of disease in an animal population. Epizootic means it's a epidemic outbreak of disease in an animal population is known as epizootic. These all are the main terminologies are seen in our community. That is, endemic means the constant presence of disease within a geographical area. It's contain hyperendemic, mesoendemic and holoendemic. Then epidemic means an outbreak of disease in a community in excess of normal expectation is known as epidemic. Example COVID-19. Same pandemic is same as that epidemic, but it is mainly more over that country or over whole world. Then sporadic means the incidence of single scattered cases of disease. It says scattered cases of single one or scattered cases of disease is known as sporadic. Exotic means a disease is imported into a country. Epidemic disease is an outbreak of disease in a bird population. Zoonotic disease means infections that are spread between people and animals. Epizootic means epidemic outbreak of disease is in an animal population. Then some questions we have here are: first case come to notice to the physician is known as first case come to notice of physician is known as index case. Notice of physician is known as index case. In some cases, first case come to notice of physician is primary case. Here difference is first case come to notice of physician is known as index case, and first case come to not notice of physician is primary case. Then we already know about after 24 hours then OR solution is prepared, then after 24 hours it should not to be used. Before 24 hours it can help to use that ORS solution. After 24 hours of ORS solution preparation it become discarded, not to be able to use. Then number of sputum specimen collected for TB. How many times we will collect the sputum specimen for analysis of TB is 3 times. 3 times. Then flaccid paralysis, fever, sore throat and constipation. These all symptoms we mainly seen in which condition? Polio. Flaccid paralysis, fever, sore throat, constipation mainly seen in polio. Then we already have acquired immunity, passive immunity. Then there is another immunity is humoral immunity. This is based on the production of antibodies. Humoral immunity means based on the production of antibodies is called humoral immunity. Chickenpox rashes first appeared on. Where is the chickenpox rashes is first appeared in my trunk, in our trunk. Then rashes of measles first occurs on. Measles rashes are first occurs on faces. Then blood samples from a patient with malaria should be blood samples from a patient with malaria. We take the blood sample of patients with malaria at the peak of their temperature or peak of the disease time. We will take the blood sample from malarial patient. Then the aldehyde test that can of Napier is used for Kala-Azar. Aldehyde test of Napier is used for Kala-Azar disease. This all about the main questions and asking and some terminologies in community health nursing we can use. If you have any other doubt, please comment on that inbox, and please subscribe my channel, and I will add further questions in all each portions of community and other subjects. Thank you.